You need to look at your metabolic health because you might feel great, but your metabolic health isn't good and you're going to have a heart attack, stroke, cancer, autoimmune disease. You just get diagnosed with diabetes out of blue, etc., because you didn't get your metabolic health checked. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgeries. Be sure to subscribe for more videos like this one. I just wanted to read some statistics that we have on metabolic health. So here are some really interesting ones. Is 34% of US adults have metabolic syndrome. Key criteria include waist circumference, high blood pressure, elevated fasting glucose, high triglycerides, and low HDL cholesterol. Cardiovascular disease doubles risk of heart disease and strokes. Type 2 diabetes, 80% of those with metabolic syndrome are at high risk. Other conditions linked are liver disease, kidney disease, sleep apnea, higher prevalence in Hispanics and non-Hispanics, black men up to 55%. Significant increase for non-Hispanic white women, also 44% over recent decades. Older adults show higher rates with up to 70% of women aged 70 plus affected. Normal weight individuals with metabolic syndrome have higher mortality risk than obese counterparts without it. Normal weight individuals with metabolic syndrome have a mortality rate over double that of healthy normal weight individuals. Let me talk about okay, we have a statistic. I would say it's as high as 80% of people have poor metabolic health because with metabolic syndrome, you have to have at least 3 or more markers. Like you have to have a waist circumference of 40 or greater in men, greater than 35 in women, and you have to have high blood pressure or blood sugar issues. And people definitely don't have to have all 3 of those to have poor metabolic health. The statistic is off, right? You need people that have really poor metabolic health. So I would go as high as at least 80% of people have poor metabolic. So if 80% of people have metabolic health issues, what should we do, right? The big thing is what we need to do is we need to get our blood checked. Because what's the big thing is you might not have any clue that your metabolic health is having issues, but you might be functioning perfectly. You might have good energy. You think, well, you're killing it in work or whatever, right? But your metabolic health is in the toilet. So what you need to do is actually go to a doctor that actually specializes in metabolic health and get their labs done through them. And they're able to interpret it appropriately and start getting your health on track. Let's say you feel great. Who cares if your metabolic health is an issue, right? Well, you might be running marathons and you might have a heart attack, right? We don't want that. Have you ever been talking to a friend? I know I hear this among my friend group all the time and be like, wow, this person was running marathons all the time and they just recently had a stroke. Can you believe it? It's like, there's nothing you can do. You can do whatever you want. You could be running marathons all the time and you're still going to die. See, that's not really the truth of what it is what you need to look at your metabolic health because you might feel great, but your metabolic health isn't good and you're going to have a heart attack, stroke, cancer, autoimmune disease. You just get diagnosed with diabetes out of blue, etc., because you didn't get your metabolic health checked. So what labs do you need to get done to actually check your metabolic health? First, we need to start with blood sugar. This is a huge one. If you have blood sugar that's out of whack, it is going to lead to so many health issues in the future. It's because it's really damaging the mitochondrial cell membranes, the mitochondria, the cell membrane on the outside of the cell, etc. So we want to check a fasting blood sugar. Very important, but it's not like we just want to check a fasting blood sugar. We need to check a hemoglobin A1C. This checks where your blood sugar is at over a 3-month period of time. You want to do a fasting insulin, and you also want to be doing a C-peptide. So ideal range for a fasting blood sugar is less than 100. Now, if it could be even better, if it's in the 80s, that would be great, but you really don't need to stress out. If you have a fasting blood sugar in the 90s, you're good. Your blood sugar is doing pretty good. But here's the kicker. You might have a fasting blood sugar that's great, but your hemoglobin A1C, which checks your blood sugar over a 3-month period. So ideal is you want your blood sugar, hemoglobin A1C to be between 4.8 to 5.6. That's the ideal range. If you're 5.7 to 6.4, you're pre-diabetic. And if you're above 6.5, you are full-blown diabetic at that point. So I have seen in my office patients that have a normal fasting blood sugar, but their hemoglobin A1C is not good. They might have a hemoglobin A1C of 6, for example. but their fasting blood sugar is great. So you can't just do one or the other. You need to order both. Now, why do we really care about insulin, right? It's because, okay, if your blood sugar is normal, your insulin should be normal, right, too. Not necessarily. You want to have an insulin from like 2 to like 24. That is normal. The lower you could get your insulin, the better, but you don't want it too low, because if you have too low of insulin production, guess what? You're not going to get sugar outside your bloodstream and into your cells very well. So way too high, that's telling us, oh wait, your cells are starting to become very insulin resistant, and your pancreas is becoming taxed and producing way too much insulin, and then your pancreas is going to get tired over time, and then you're not going to be producing your own insulin over time. So this gives us a good look what's happening in your body, because someone could have blood sugar issues and they're just making too little of insulin, not necessarily type 1 diabetic type of thing. And that's one reason why they have blood sugar issues. But also it might be, oh, they have really high insulin. Okay, that's another factor that needs to go into play. And this really helps the doctor identify really how to approach their disease appropriately. You see, peptide is another test that I like, very similar to insulin. It's another way to really monitor your insulin levels and get a good idea of what's going on in that regard. So blood sugar, a huge thing. You need to go to a doctor that really knows what they're doing about that. Just not checking and looking at the basic normal ranges. Really someone that really is going to look at it, all the nuances that are involved to really get your blood sugar in check and improve your metabolic health. So next one I wanted to talk about is HDL. So HDL is our healthy cholesterol, is our good cholesterol. It takes bad cholesterol out of the body and eliminates it. So LDL is bad cholesterol, VLDL is bad cholesterol, lipoproteins, all bad. This is all bad stuff. But the big one I like to look at is then the most important of all is your HDL. That helps me really look at your metabolic health. And you want that number to be 45 or higher. And even more ideal would be 50 or higher with your HDL. That means we're actually able to build good cell membranes, and we aren't putting all this gunk in our cell membranes and leading to poor metabolic health in the future. Another one that's somewhat similar to HDL, but it's not, is triglycerides. So that's the fatty acids that are in our bloodstream. So if you're not metabolizing very well in your cells, like you're not metabolizing blood sugar very well, or you're not making energy production very well, triglycerides start to go up. So that's a key marker that we see, okay, your cells aren't working very well because your triglycerides are up. We need to look further and really work on healing your cells because your triglycerides are too high. So where you want your triglycerides is you want them below 100 is ideal, and even better if you could be at 60 or lower. But I'm still happy if my patients have a triglyceride level below 100. That's a very healthy level for your triglycerides. So next thing I wanted to talk about is your thyroid health. So big thing you do to check your thyroid health is TSH. That's the basic of the basic. I also like to look at a free T4 and a free T3. But you want at least your TSH to be 3 or lower. And you don't want it too low. You want it from like 0.45 to 3. If you have your TSH in that range, it is a good, healthy range. That means that your cells are getting the signal appropriately to make your mitochondria work appropriately. Next one I want to look at is I like to check your cortisol, what's called your circadian rhythm. Check your morning, afternoon, evening, nighttime cortisol levels. Cortisol between like 5 to 9 in the morning is really healthy. Cortisol between like 2 to 4 is really healthy in the afternoon. Evening cortisol between like 1 to 3, and then you want your cortisol like from 2 or lower when you want to go to bed. So it's just about looking at the lab. We order a lab. I like to do a spit test to do this and really get a good look at what's happening with your cortisol. And we can really see how stressed your body is. You might think mentally that you're not very stressed, but you are. It's able to pick that up. It's like, okay, maybe you're not taxed mentally, but maybe the physical activity that you're doing or the exercises that you are doing are causing too much stress on your body. And we need to make modifications to that. How often should you get these labs done? So you need to get these labs done at least once a year, but ideal is every 6 months to really dial in if the changes you're making in your life or the treatments that your doctor has prescribed are actually doing what they need to be doing. So every 6 months is ideal. At least every year you want to be checking your labs. And in our next episode, we're actually going to be talking about what can you actually do to heal your metabolic health or improve your metabolic health and get that mitochondria working at optimal levels. If you want to learn more about how to heal your metabolic health, click my videos to the right. I'm Dr. Jake, and I'll see you there.